Hi there.
Hi.
I'm Gwen McKee. I'm the nurse practitioner student working with you today. How are you?
Good. Thanks.
Good to hear that. And so I will be recording a video of our time together and uploading it to YouTube as unlisted. But before I do that, I just want to get your permission. Do I have your permission to take a video of our time together?
Yes.
Thank you for that. And for Professor Williams, I do not yet have my lab coat because I have not yet attended immersion, but I shall be getting it in a couple of weeks. So thank you. And let's get started here. So can you please tell me your name and date of birth?
Michael Smith, June 10th, 1970.
Awesome. Thank you for that. And then that makes you how old?
53.
Okay. And what is your race?
I am white.
Okay. And your ethnicity?
Non-Hispanic.
Okay. And what is your gender?
I am male.
And your birth gender?
Male.
Okay, thank you. And how did you come to the clinic today?
It's my time for my annual physical.
Okay, great. And did you drive yourself or come with somebody?
No, I came alone and I drove.
Okay, great. And you said you're here for your annual physical. So when did you have your last physical? Month and year, approximately?
It was July of 2022.
Okay. Thank you. And are you having any health concerns today?
Nope.
Anything bothering you?
Not at all.
Okay. And I'm just going to go over your last preventative screenings with you.
Okay.
So you are 53. Have you had your colonoscopy?
Yes, at 49.
Okay, great. And did they find anything abnormal or?
Nothing abnormal.
Wonderful. And have you ever had your cholesterol and your triglycerides checked?
Yes, last year I had my blood work done. My LDLs were a little high, but I was able to change my diet and then now ready for new blood work, so hopefully I did good.
Oh, good job. I appreciate that. Makes my job easier. And have you ever been screened for prediabetes or diabetes?
Nope. My A1C on my last test was within margins, so I guess that was the test.
Okay. That's good to know. That's really good. And do you remember when your last eye exam was?
6 months ago. Had my eyes, I do wear glasses, and so
okay.
Had my eye exam.
Wonderful. And your last dental exam?
5 months ago, so I'll be going for another cleaning in another month.
Wonderful. And any abnormalities with your eye exam or your dental exam?
Nope.
Okay, good. And do you check your blood pressure at home at all?
I do not. I did have it checked just last month for my CDL.
Okay.
And it was 132/80.
Very good. Does that seem to be your trend when you've had it checked in the past?
I do take a blood pressure medicine for hypertension, and it keeps it pretty steady right there.
Wonderful. And we'll go over your medicines in a minute. I see you brought your meds with you, so good job on that. Have you ever been screened for hepatitis or HIV?
No.
Okay. It's actually recommended for everybody once in a lifetime. So if you'd like to get that done this time around, just let me know.
Okay.
We can work on that. And have you ever been tested for sexually transmitted infections?
Have not.
Okay. So not for chlamydia or gonorrhea, anything like that?
Nope.
Okay. And then for your medical problems, you did mention hypertension. Do you have any other health issues?
I take a Protonics for not GERD, but
heartburn?
Heartburn, thank you.
Yeah. Well, GERD and heartburn are about the same thing. GERD is gastroesophageal reflux disease, so kind of a long name there. But yeah. So, have you had any surgeries in the past?
I've had a hernia surgery, a double hernia.
Okay.
Abdominal.
Okay.
I've had a vasectomy, local, and I had vein stripping, which is a local as well, but I did go under for the double hernia.
Oh, okay. And do you remember the months and dates on those?
My double hernia was in 2019.
Okay.
It was summertime, so I remember it being hot.
Okay.
And so like August.
August. Okay. 2019.
And then my vein stripping was in 2022.
Okay.
For varicose veins.
Okay.
And my vasectomy was I was 23.
Okay.
So that was a long time ago.
While ago. Okay, very good. And are you up to date on your immunizations? For example, did you get all of your childhood vaccinations?
Yep, all of them.
Okay. And have you had a tetanus shot, or let's say, when was your last tetanus shot?
I'm pretty sure it's 5 years ago.
Okay, 5 years ago. Great. So if you were to get a metal injury, since you're at that 5-year mark, I would recommend getting a booster, just because you do get it every 10 years, but if you've had the injury, you want the booster to be within the last 5 years. Okay?
Okay.
And did you get your flu vaccine this last season?
I get my the flu shot every year.
Good job. And have you been vaccinated for COVID?
Yes, and my second booster.
Okay, wonderful. And have you ever had the shingles vaccine?
I have not.
So that vaccine is for herpes zoster, which is actually the same virus as chickenpox. And so it is recommended for you since you're over the age of 50. And it helps just so you don't get shingles, because the chickenpox will live in your body. And then as your immune system fades, shingles can pop up and it can be pretty painful. So I'll let you think about that. You let me know if you're interested in that vaccine, okay?
Sure.
Have you had any significant childhood illnesses?
No.
Like rheumatic fever, frequent strep throats, or?
Nope.
Okay. And we'll talk about your allergies. So have you had any allergic reactions to medications?
I've not. I'm not, as far as I know, I'm not allergic to any medications.
Are you allergic to any food that you know of?
Not that I know of.
Great. Do you have any environmental allergies, like to dust or cats?
No.
Okay.
I heard puffer fish is bad for you, though.
Okay. All right. Well, stay away from that puffer fish then. Do you have any seasonal allergies, like to pollen or any hay fever?
Not yet.
Okay. And are you allergic to latex?
No.
Okay, wonderful. So yeah, if I may take a look at your medications there. So you said heartburn and then hypertension. So I see your lisinopril 10 milligrams, and you take 1 tablet daily. Is that how you take it, as it's written there?
Yes.
Okay, wonderful. And you take that for your blood pressure. And then pantoprazole, the label says 40 milligrams, 1 tablet daily, 30 minutes before a meal. Is that how you take this one as well?
I do.
Okay, awesome. Thank you for that. And then oftentimes we need over-the-counter things. Do you take any over-the-counter medications?
Occasionally I'll take ibuprofen.
Okay.
And occasionally I'll have Tums.
Okay.
If the Protonics doesn't work, I take the Tums.
Oh, okay. So we'll start with the Tums. Do you know the dose on that?
It's the big tablets. I think they're 1,000 milligrams.
Mm-hmm.
Yeah, I take 2 of those.
That sounds right.
If I do take them, I take 2.
Okay, times 2. Okay. And then how often would you say you take those?
It's rare. Once every couple months.
Okay.
Yeah, it's rare. Protonics, it's good stuff.
I'm glad to hear that's working for you.
Yeah.
And then the ibuprofen, how much of that do you take typically?
I try to keep it like with 600 milligrams, and I only take it when I have a muscle ache.
Okay.
Or sore from doing something abnormally, but typically it's just from my muscles.
Okay.
Yeah, for soreness.
Sounds good. And then how many of those tablets do you usually take?
600 milligrams, 3 of the 200s.
3 of the 200s.
Yeah.
Okay. And then you said maybe once a week or once.
Oh no, once a month. I try not. I try to work through it, so.
Okay.
It's only when necessary.
Okay. When you've been doing some different kind of activities.
Yeah, something abnormal that your muscles aren't used to. And typically it's a back pain that I'll have, but I don't take it very often.
Okay, great. And then do you take any supplements or vitamins?
Yeah, I take nightly. I'll take a multivitamin,
Okay.
50 plus Centrum for
Okay.
men, and then I'll take 2 vitamin Ds.
Okay.
The 50s, I think they are.
50 micrograms?
Yeah.
Okay.
And then, yeah, that's all I take at night.
Okay, great. And what is the reason that you take the vitamin D?
Well, last year, my last physical said I was deficient in vitamin D.
Oh,
so
okay.
I'm trying to boost that up.
Okay. Have you had it rechecked since last year?
Not yet.
Okay. Well, we can definitely work on that with you. See how you're doing. Probably doing great. And do you take any herbal remedies?
I do not.
Okay. And now we're going to cover substance use, chemicals that you use. Do you use, well, tell me about your alcohol use.
I typically have 1 to 2 on the weekends, go out to dinner, and so I'll have a beer or a glass of wine.
Okay. And what are your reasons typically for?
Food and flavor enhancement and relaxation, just to kind of relax and lighten the mood a little bit. Maybe.
And what do you typically like to drink?
Typically it's beer, but occasionally red wine.
And how old were you when you started using alcohol?
Probably in my 20, 21, 22, right around there.
Okay, so early 20s.
Yeah.
Okay. All right. Do you use or have you used any tobacco or nicotine products?
I have not.
Okay. Any cigarettes, cigars, or vaping?
Nope.
Oh, all right. Well, good job. Your lungs will be much happier with you.
I hope so.
So, moving on to recreational drug use or illicit drug use. Or tell me about your experience with, say, marijuana or methamphetamines, heroin, anything like that.
No, stayed away from it.
Okay, great. Wonderful. Well, that's also very good for your health, as you know. So talk to me a little bit, if you would please, about your diet. For example, do you have any restrictions?
I restrict myself on the carb side, the bread side, the white bread side.
Oh, okay.
I try to eat more keto-ish, meat and veggies, vegetables. So
okay.
I don't like a lot of bready products. So
yeah. Well, that's good for you. Yeah. The whole grains are better for you. Do you restrict carbs altogether?
No, I still have bread with my sandwiches for lunch, and I'll have chips. So I do get my carbs.
Okay.
I'm not strict keto, but I prefer that type of dinner.
Mm-hmm.
Just try to cut the carbs. Not a lot of potato, not a lot of breads.
Okay. And how often would you say you eat red meat?
Probably once a week.
And okay. And vegetables? How often?
I try to eat vegetables daily.
Wonderful. Your intestines will thank you for that. Helps with the fiber, moving everything through, decreases your risk of colon cancer. Really good for you. And how often would you say that you eat salty foods?
Like I said, I'll have chips in the afternoon for my lunches. And so I do not add salt to my meals.
Okay, good.
The wife, she cooks with salt, but I do not add additional salt.
Yeah, and definitely with your high blood pressure, if you can use a salt substitute, it's actually better for you. It's made with potassium, and potassium is great for your heart. So maybe you can get your wife to switch over. It's actually called no salt.
Oh.
You can get it just at the grocery store and like the cooking aisle. So.
Oh, cool. Sounds cool.
Yeah.
I'll have her look into it.
Wonderful. And how often do you eat fast food?
Rarely. Once every 2 weeks.
Okay.
It's typical.
Good. That's good. That's better for you. Decrease the fats, the salt, the refined carbohydrates. That's great. And tell me about your exercise.
I'm very active at work. I'm very active at home.
Okay.
So I lift, pull, push stuff all the time.
Okay.
And And then I lift daily, Monday through Friday, typically about 20 minutes, free weights.
Okay, that's great.
Just to stay toned, nothing, no bodybuilding or anything, but mainly to keep my back strength up because I do have a weak disc. And so I've got to watch that.
Okay, great. Is that weak disc causing you any problems right now?
Nope.
Okay. Has it ever caused you like any weakness or paralysis or?
No, it's just a lot of pain. Last couple days, that's why I would take the ibuprofen typically for the muscle soreness and stuff like that. Yeah.
Do you find that the ibuprofen helps you?
Oh yes, very good. That's good.
All
It doesn't happen very often with the slip disc, but when it does, ibuprofen is my friend.
All right, and definitely rest when that when that happens, so you're not aggravating that area and causing more inflammation.
Sure.
Wonderful. And do you do any aerobic or cardio?
I do not.
Okay.
I should, I don't.
That's very good for your high blood pressure as well. That'll help bring your high blood pressure down. So yeah, think about that. 30 minutes, even 3 times a week would be really helpful.
Okay.
And do you use any caffeine?
I drink typically 2 cups a day, every morning.
Okay. Any issues with that?
No issues.
Okay. And then in terms of your social history, are you employed or are you retired?
I work
you
full-time.
said you worked. I'm sorry.
I work full-time.
Okay.
40 plus.
And what kind of work do you do?
I'm in telecommunications.
Okay.
I'm a fiber optic splicer.
Wonderful. All right. And you said something about a CDL. So do you do much driving?
I did get my CDL. I don't drive full-time anymore. I do use it at work to transport heavy equipment when needed.
Okay.
To help out.
And just in terms of safety, do you use your seatbelt?
I do.
Okay, great. Are you exposed to any chemicals at work?
No, I'm not.
Or in any physical danger?
Nope.
Okay. Do you do any repetitive motions?
No, I'm like I said, very active, and every day is different.
Okay. And how would you rate your satisfaction with your job?
It's good.
Low, medium, high?
No, it's a high. I like my job. I like what I do.
Great. And in terms of life stressors, how would you rate your life stressors?
Very low.
Low? Okay. And do you have social supports that sort of help you when
Yes.
you are stressed, or?
My wife and I communicate very well. My dad calls, and so we communicate.
Okay.
And then I have church, and able to communicate there as well.
Wonderful. Thank you for that. And what's your living situation? What type of dwelling do you live in?
Home. I live in a house with my wife and no kids.
All right. And what's your relationship status?
It's married, no children.
All right, and you live together.
I do.
You did say spouse. And do you have any disabilities or difficulties at home with like stairs?
No difficulties.
Okay. And what is your military status, please?
Did not serve.
Okay. And is it okay if I ask you about your sexual and reproductive health?
Sure.
Just as an overall addition to your health. That
Sure.
way I can partner with you and get you in tip-top shape as best as possible. So, are you sexually active?
I am.
Okay. And do you use any contraception?
I do not. No.
Well, you've had the vasectomy.
I had a vasectomy
Okay.
at 23.
Very good. That's good contraception.
Yeah.
And do you use any protection for sexually transmitted infections?
No.
Okay. And in the last 6 months, how many partners would you say you've had?
1.
Okay. And how many children do you have, if any?
3 boys.
Okay. Any trouble with infertility in the past?
No.
Okay, wonderful. And what is your sexual orientation?
I am a straight male.
All right. And do you feel safe at home?
Yes.
Any history of like domestic abuse or
Nope.
partner violence? Okay. Do you consider yourself a spiritual person or atheist or?
Yes, I go to church.
Okay.
Try to regularly.
Okay.
Yeah.
All right. And so do you have like a specific religious affiliation with your
Protestant.
church? Protestant? Okay,
Yep.
great. And we talked about seatbelt use. Do you have any use for helmets?
Yes, I wear a helmet every time I ride. I ride a dirt bike and a street bike, and I wear a helmet.
Okay.
Yep.
Good for you. Yep. That comes in handy if you ever get in a crash, as you know.
Yep.
Do you do any texting while you drive?
I do not.
Any drinking while you drive?
I do not.
And do you have any guns in the home?
I do not.
Okay. Do you have a pool or a hot tub?
Soon, but not yet.
Not yet. All right. So you'll want to make sure there's a fence around it, just in case you have kids that come over. Just to be on the safe side, of course. I'm sure you know that.
Oh.
And now I would like to go over your family history with you.
Sure.
Just to kind of tie in, genetically speaking, what you might be at risk for, knowing what your grandparents and your parents have had and your siblings, okay?
Okay.
So your mother, is she still living?
Yes.
Okay.
My mother is 80.
Okay. And does she have any health issues?
She has diabetes.
Okay.
Type 2.
Okay.
And she's had open heart surgery.
Oh, okay. So a little heart disease in there?
Yep.
Okay. And how about your father?
He's also 80. And he has had prostate cancer. And
Okay.
they removed that. And he still deals with skin cancer.
Okay. Anything else?
Nope.
All right. And then how about your mother's mother? Is she still alive? Or?
No, she died when she was 83.
Okay.
And she had lung cancer.
Okay. Died from lung cancer then?
From smoking.
Anything else in her history?
She did have a heart attack, but I think that was due to the smoking.
Oh, okay. Okay, and how about your mom's father?
He died early at 77.
Okay.
He had 7 heart attacks.
Oh, wow.
Died on the last one.
Wow, that is a lot of heart attacks. I'm sorry to hear that. And then how about your father's mother?
She died at 63 from lung cancer. She was a smoker.
Oh, okay. Any other health issues with her that you know about?
Not that I know of.
And then your father's father?
He died at 83, and he had heart failure.
Oh, okay. And that's what he died from?
That's what they said.
Okay. Any other health issues that you know about?
I don't think so.
And do you have any siblings?
I have one sister. She's older.
Okay.
She's 54.
Oh, okay. Any health issues with her?
She has Hashimoto's, something going on with her thyroid.
Thyroid, okay. And then your children, what are their ages?
28, 26, 24.
Okay. And any health issues with your 28-year-old?
No, all 3 of them are very healthy.
Okay, awesome. That's good to hear. Wonderful. Now, we'll just go kind of head to toe. I'll ask you about each of your body systems. Just let me know if you've had issues with these, okay? Or currently,
Sure.
of course, count. So, are you having a fever?
No.
Or chills?
No.
How about weakness or fatigue?
No.
Okay. Any changes in your weight?
Nope.
Any changes in your appetite?
Nope.
All right. So, in terms of your eyes, you did talk about your eye exam. Do you wear glasses or contacts?
I do.
And do you feel like that's a good prescription for you?
That's great, yeah.
Okay,
Been
great.
steady for 2 years.
That's good to know. Especially with hypertension, it can affect your vision. It affects the blood vessels in your eyes. So I'm glad to hear that you're getting your eye exams.
Yep.
It's really good. Have you had any changes in your vision?
No, it's been steady.
Okay. So no double vision or blurred vision,
No.
flashes, floaters,
Nope.
tunnel vision. Any eye pain?
None.
Redness?
No.
Any itching?
No.
How about discharge or tearing?
Nope.
Okay. And then moving on to your ears. Have you had any changes in your hearing or hearing loss?
No, it's good.
Awesome. Any ringing in your ears?
No.
Okay. Any earaches or ear infections?
No.
Or drainage?
No.
All right. And then moving on to your nose, have you dealt with any sinus infections or sinus pain?
Mm-mm.
Okay. How about bleeding or drainage?
No.
Frequent runny noses or congestion?
Nope.
Frequent colds?
Nope.
Have you ever been told you have like a deviated septum or polyps?
No, I have not.
Okay. And then just in terms of your mouth and your jaw, any jaw problems?
No.
Any mouth issues?
No.
Any dry mouth or tooth pain?
No.
Bleeding gums?
No.
Any sore tongue?
Nope.
Wonderful. And then in terms of your throat and your neck, have you had like any lumps or swollen nodes, anything like that?
Nope.
Any difficulty swallowing?
No.
Or stiffness in your neck?
No.
Any sore throats or hoarseness?
No.
Wonderful. In terms of your heart, you do have the high blood pressure. Have you ever had any chest pain?
No.
Or palpitations?
No.
Ever been told you've had a murmur?
Nope.
Do you have any trouble breathing, say when you're lying down at night?
Nope.
Any trouble breathing with exercise?
Nope.
Okay. Have you had any swelling in your hands, your ankles, or your feet?
Nope.
Okay. Any change in color, like blue fingers or toes?
No.
Any leg pain or cramps?
Nope.
Any leg swelling
Nope.
or varicose veins?
No.
Okay. Any venous clots in your veins?
No.
Wonderful.
Well, I told you about the stripping, the vein stripping.
Okay, and that was related to varicose veins then?
Correct.
But
yeah.
no clots?
No clots.
Oh, okay.
Just bulging, kind of
Okay.
and a little swelling, and
Okay.
that's why I got them stripped. So.
Okay. Any issues since then?
No, they're great.
Okay. And that was both legs, you said?
Did have them both done.
Okay. All right, wonderful. And in terms of your lungs, any lung issues?
Nope.
Any cough or phlegm production? How about wheezing?
Nope.
Night sweats? Pain with breathing?
Nope.
Great. And in terms of your abdomen and your intestines, so your gastrointestinal, any abdominal pain?
No.
Nausea or vomiting?
No.
How about diarrhea or constipation?
Not today.
Okay. And you do have the heartburn.
Yep.
That's controlled.
Yeah, it's controlled.
All right. So you said not today on the diarrhea or constipation. Is that something that you deal with in the past?
No.
Or? Oh, okay. More.
Everybody gets it every now and then, so.
Sure.
Yeah.
Okay. Not an ongoing problem for you?
No.
Do you have any excessive gas?
Nope.
Or belching? Any blood in your stool?
No.
Or hemorrhoids?
Nope.
Okay. And then we're going to move on to your urinary system. And then, so do you have any difficulty urinating?
I do not.
Any pain or burning?
No.
Any urgency?
Just when I have to go.
Okay. Does it feel like a normal have to go, or is it
It's a normal.
like a lot? Okay. Any frequency with your urination?
Nope.
Like where you get up, say, more than once per night?
Nope.
Okay. Any difficulty starting your flow?
No.
Or a decreased urine flow?
No.
Okay. Any blood in your urine?
No.
Or okay. Urinary tract infections?
I don't think so.
Okay. Any prostate enlargement?
No. Dad had the prostate
Right.
problem. We're keeping an eye on it with the blood work,
Okay.
but as of now, no.
And how's your blood work been so far with your prostate?
It's been good numbers. So we just got to
Okay.
keep an eye on it with my family history.
Sounds good. And typically we'll start that at 55 years of age, but since your dad did have a previous history, it's not a bad idea to do that younger. So
Yeah.
I'm glad you've had that checked. And we talked about urinary tract infections. Any kidney stones?
No.
Okay. And then in terms of reproductive health, you said you've not had any sexually transmitted diseases that you're aware of. How's your libido?
It's good.
Okay. Any erectile dysfunction?
No.
Any discharge from your penis or any sores on your penis?
Nope.
Any issues with your testicles or your scrotum?
No.
So no pain or swelling? Any masses?
No. No.
Great. I'm glad to hear that. And then, sorry for all my flipping. I've got all the good stuff here though, you know. So, in terms of your musculoskeletal health, you did talk about the disc issue. Any back pain?
No, only when I hurt. If the disc slips out, obviously yes, but no, typically no.
Okay.
That's why I try to do my exercises,
Okay.
my free weights to keep my muscles toned. That way it doesn't happen.
Okay.
Preventative maintenance.
Okay. And you feel like the ibuprofen, the exercise, the rest is working for you okay? On
Yes.
controlling your back pain and your disc?
Right.
Okay, good. Let me know if it's not at some point. Do you have any other joint problems?
I do not.
Any fractures or dislocations?
I broke my arm at 8 years old, broke my collarbone at 24, 5-ish. Oh no. No. That was a partial separation of my shoulder at 24. Collarbone at 15, arm at 8.
Okay, collarbone at 24 years old, partial separation.
No.
Sorry.
Collarbone at 15.
Oh, at 15. Sorry.
Yeah. Partial shoulder separation at 24.
Oh, got it. And then a fracture of your arm at 8.
Yeah.
Have you had any ongoing issues with those fractures?
None.
Any arthritis type symptoms?
Nope.
Any gout symptoms?
Nope.
Your toes hurt? Any serious sprains?
Softball, ankle sprain, but nothing serious.
Okay.
Nothing lifelong lasting.
I'm glad to hear you're not having any issues with that. That's good. And in terms of your skin, any sores or lumps?
Nope.
Rashes or itching?
Nope.
Any excessive dryness or oiliness?
Nope.
Problems with acne ongoing?
No.
Any new moles or changes to your current moles?
Nope.
Any change in your hair or your nails?
No.
All right. And then little known fact, men can also get breast cancer. So have you had any lumps?
Not that I know
Pain or soreness?
of. No.
Any nipple discharge?
No.
All right, thank you for that. And then just moving on to your head. So any headaches?
Nope.
Any dizziness?
Nope.
Fainting?
No.
How about any seizures?
None.
Past head injuries?
No.
Any problems with your memory or speech?
Nope.
Any muscle weakness?
Mm-mm.
Any paralysis?
No.
Any muscle spasms or tremors?
Nope.
Any numbness or tingling?
No.
All right. Good job on that. And then I'd also like to go over your psychiatric health, if that's okay.
Sure.
And we're almost done.
Great.
So, do you have or have you ever struggled with depression?
No.
Any suicidal ideas or attempts?
Nope.
Do you struggle with anxiety or tension?
I do not.
Okay. Do you ever feel like you can't settle down, like you're having a manic episode?
No.
Okay. Do you ever have any binges of alcohol or food or
No.
other substances?
No.
Okay. Any issues with insomnia?
No.
Okay. Any changes in your mood or your attitude towards your friends, your family, or your work?
No.
Okay, great. And then just in terms of your blood health, any history of anemia or easy bruising?
Nope.
Or easy bleeding?
No.
Okay. Have you had any past blood transfusions?
I'm not.
Okay. And have you had any changes in your energy or feeling tired?
No.
Any issues with your lymph nodes, swollen, tender?
No.
Okay, great. And then endocrine, I'm going to cover, and that's kind of like your hormone balance. And so, do you ever feel like you have increased appetite or thirst?
No.
Or urination?
No.
Okay. Any intolerance to heat or cold?
No.
Any excessive sweating?
No.
Or growth problems as a child?
No.
Great. And then just in terms of your allergies and your immune system, I know we talked about earlier you didn't have any allergies, But have you ever experienced any hives or swelling of your lips or tongue?
No.
Okay. Any frequent sneezing?
No.
Or itchy eyes? All right. Any frequent clearing of your throat or postnasal drip?
No.
Any eczema or atopic dermatitis?
Nope.
Great. Do you feel like you get sick more frequently than others?
No, I don't. I feel like I'm healthier more than others.
Okay, good. Or that you take longer to recover from anything more than others?
No.
All right, wonderful. Well, I think we're pretty much through here. Let me just double check and make sure I've got all your information. That's wonderful. Do you have any questions for me before we go?
You're going to give me my, not prescription, but we'll get my blood work done, and then I might look into the tetanus shot.
Well, thank you for that. Well, it's been nice to meet you, and I will see you next time.
Okay, sounds good.